Today we'll be discussing on furunculosis. Now, what is furunculosis? Furunculosis is the infection of a single hair follicle resulting in a localized form of otitis externa. It is well circumscribed, deep skin infection initially, followed by a pustule formation in the external auditory canal cartilaginous part, which may progress to local abscess formation. Now, how would a patient of furunculosis present to you? He will complain of earache, blocked sensation in the ear, and sometimes serosanguinous discharge. Now, what is serosanguinous discharge? It means it is serous as well as blood-stained discharge. There will be tragal tenderness, that is, when you press on the triggers, the patient will cry out in pain. Usually, the cartilaginous external auditory canal is affected. Now, why is cartilaginous external auditory canal affected? This is because your cartilaginous external auditory canal has hair follicles, and as you know that furunculosis is usually the staphylococcal infection of the hair follicle. Now, how would you differentiate for a case of furunculosis from mastoiditis? Let's see. Now, these are the differences between acute mastoiditis and furunculosis, out of which there are some points which you need to understand. Now, why will there be post-auricular sulcus obliteration in furunculosis? This is because if there is inflammation of the external auditory canal, then the retroauricular sulcus, which is just associated with it, gets obliterated. The pinna is usually displaced forwards in case of furunculosis, while it is displaced forwards, outwards and downwards. Now, the other features are but obvious. If you move the pinna, it causes pain in case of furunculosis, but not so in case of acute mastoiditis. There will be tragal tenderness in a case of furunculosis, whereas there will be tenderness along the mastoid region in case of acute mastoiditis. There will be a tympanic membrane may be perforated or congested in case of acute mastoiditis, whereas it is usually not so in case of furunculosis. There can be mucoid discharge in the case of acute mastoiditis. Now, what is a mucoid discharge? So it will be thick, mucus-like, and there will be string pearls appearance. And it is usually serosanguinous discharge in case of furunculosis. Now, what is the etiological agent usually in case of furunculosis? It is usually Staphylococcus aureus. Now, according to Scott Brown 8th edition, there is an entity known as Panton Valentine leukocidin, which has leukocidal action against phagocytic cells. By this mechanism, Staphylococcus aureus toxins cause furunculosis. Now, what are the usual causes of recurrent furunculosis? Diabetes mellitus is the most important cause of recurrent furunculosis, and you need to rule out. The other causes are hypogammaglobulinemia and dysphagocytosis. Now, how would you manage a case of furunculosis? As a patient will complain of excruciating pain, you have to provide analgesics. Antibiotics which are directed against Staphylococcal aureus like penicillin and cephalosporins can be given. Incision and drainage only in case of abscess formation following furunculosis. You can give ichthamol glycerin, which acts as anti-staphylococcal as well as a hygroscopic action. Now, what is bacterial interference therapy? So, we see that when we provide other bacteria similar to Staphylococcus aureus, for example 502A strain, then we have seen that Staphylococcal aureus infection is reduced. Moreover, there are other therapies which you can give in case of furunculosis, like you can eradicate the presence of staphylococcus in the nasal areas by application of mupirocin. So these are the other things that you can do in the case of furunculosis. I hope you understood this topic, and if you have any queries, please drop it down in the comment section. Thank you.